Those of you in San Antonio know that I've been a pharmacist now for almost 33 years. Those of you around the state don't know that my first training as a pharmacist was at the San Antonio State Hospital in 78 and 79, and it's okay, you can say my age because it's public record, that I was the pharmacist and the little pharmacist student intern doing my clinical rotations at then Arnold and Bowie wards, which was the acute schizophrenic ward. Think how exciting it was in the times there. We were doing, for those mental health professionals, we were doing the drug trials on a drug called L'Occitane. Okay, hardly even used anymore at all. But we were about the only thing other than Thorazine at the time was Haldol. And there were so many side effects, so much of our treatment, and we know what has happened in mental health since those days as pharmaceuticals have become better, as treatment modalities have become better. But I've got to tell you that the great hope that we had for minimizing and finding the correct treatments in the community for those who suffer with mental illnesses are only blunted by the fact that we do not spend the money on the community side services. And so from there I went and I was the pharmacist at the inpatient, it was an outpatient pharmacy at our 3 local mental health centers before we named it the Center for Healthcare Services. So after the first 2 years there at SASH, I was the clinical pharmacist for our mental health system and worked with those marvelous healthcare professionals on the aftercare side, on the community side. And I was taught just an amazing amount of how to be a healthcare professional by those counselors, by the social workers, by the psychologist, by the psychiatrist, by the nurse. Everybody in the system really helped me to be, I think, a really good pharmacist, because the thing you have to do first is listen. Well, I'm here to tell you that your voices need to be there in the 83rd legislative session, and your legislators in the state needs to hear you. And the reason is that our mental health issues nationally are increasing, but that our statistics in Texas are dreary, shameful. So if you think about what happens nationally with the percentage of adults who experience mental illness in their lifetime, it's about 46%. And the percentage of adults in this country who experience mental illness annually is about 26%. But what really has me alarmed is the data that says that the percentage of our young people, aged 13 to 18, who experience a severe disorder is about 21%. So what do we know about mental illness in the state of Texas? We know that our population, that we think there's probably about 3,377,000 folks in the adult population. That's about almost 18% of the adult population. And the percentage of children and adolescents with a mental health disorder, that's a diagnosed mental health disorder, is about 13%, including my niece, including my nephew. But where are we in regards to resources that Texas uses? Well, that's where the shameful part comes in. Texas ranks 50th among all 50 states in mental health per capita spending. And nationally, if you include the District of Columbia, we actually rank 51st on spending on mental health. Our per capita spending in mental health services just for the year 2009, and you know, it hasn't gotten any better for us. In fact, it's probably gotten worse, was about $38, almost $39 per person. The average per capita expenditure by the other states, that's just the average, is about $122, almost $123. So not only are we really low, folks, we're not even in the ballpark. We're not even in the game. If you take just the median of the average of what other states are spending. But I think what compounds ours is that the percentage of our Latino population, the fastest growing population, 60-some-odd% of our growth in the last 10 years was Latino growth. And so the percentage of Latino population without access to mental health treatment, just due to lack of insurance in this state, is 38%. For our black population, same statistic, about 25%. But it's not just that. If you think about the Asian population, 23% of them lack health insurance for mental health treatment. And it is, I think that is what is really, really quite dismal for us. That means that our community care organizations have to do more with less and are so very efficient. So it upsets me somewhat when I hear colleagues that come to the legislature and say, I'm only here to cut. Well, we're 51st. How far do you want to cut? Well, there is so much fluff in spending. But it's okay. They say that about public schools. They say about everything. And we know that the treatment and the cost effectiveness, I mean, just in Bexar County, when we first started our jail diversion programs, when we started the things that are cost effective, you see, for me, the conservative fiscal argument would be that type of community-based mental health treatment. For adults, it's about $12 a day. For community-based mental health for children, it's about $13 a day. Average cost of emergency room is going to be $986. So for me, if we really want to be smart for Texas taxpayers, even though it might come out of a city, county, or state budget, it's the same taxpayer. It would be to fund our treatment options at the community-based level. The average cost of a jail stay for an inmate with mental illness is about $11,000. It's 80 days at about $137 a day. Much more effective to do the community-based solutions. So that is one area. If you come up with your strategies on funding, it's got to be that you don't play the shell game, and don't allow your legislatures to play this shell game. I mean, and we are masters at it. I say we as a broad category because I voted against the budget last time because I thought we had other options, and we cut too severely. But the other things that are, I think, very important is that we know that we have a mental health workforce shortage. So the other strategies that we can do with higher ed, with training, with our mental health, anything that we can do on the higher ed side, on the education side, because a critical part of the treatment and the effectiveness is to make sure that we have a valid entry and workforce. And what's happening is our young people are not being attracted into the mental health professionals workforce. They're not. And why? Because it's so poorly funded, because the systems are doing more with less, and when young people have options, they're not coming in. And so we really need to redouble our efforts. I'm excited, though, about one thing, and I think that our criminal justice system, and particularly our juvenile justice system, is really on the right track. Just let me give you a couple of figures of what happened, again, if you get smart. We used to have about 3,000 youth incarcerated at the Texas Youth Commission. And as my friend Jerry Madden used to say, there are two types of kids. The kids that we're really afraid of and the kids that we're just mad at. And he said, Leticia, what we need to do is get the kids that we're really mad at and get them out of TYC. So what we did, the legislature did under the leadership of Jerry Madden and the Dean of the Senate, John Whitmire, is that we cut TYC funding by $247 million. We moved $100 million of that into the community-based services, intent supervision, probation, parole, saving the state $147 million. So now we have less than 900 youth incarcerated at TYC. But guess what the good news is? At TYC, once those youth were released back into the communities, they had an 80% recidivism rate, not back to TYC, but to TDCJ. In the 2 years that we have completed this transformation, only 22% of the youth that are now in those community-based solutions go back to either TYC or to TDCJ. So our outcomes are better, we're saving taxpayer dollars, and it's working. We know that that's the type of approaches that we need to take. I chair the Veteran Affairs and Military Installations Committee, and I've got to tell you that much of our focus this interim has been with the mental health issues for our veterans. We have 1.8 million veterans in this state, or about 8% of the population. But veterans make up almost 22% of our suicides. It's jobs. It's that peer-to-peer counseling. It's the inability of the VA to respond. Things are getting better, all on bases and on our military outposts. But what we're finding is that with that warrior culture, they don't seek help. And so the things that have been successful, like our drug courts, the veteran drug courts, because a lot of times that veteran will interface with the criminal justice system. They'll go to the hypervigilance, abusing drugs and alcohol. Socialization just stops, and then they'll get in trouble with the courts. So our Department of State Health Services has been working on that as well. I'm really proud, though. I disagree with the governor on a lot of things, but when I asked him for more money for at least some peer-to-peer counseling for veterans, they came up with about $4 million. You know, we always give the governor walk-around money in the budget, and that was a little bit of what he did. So I want to say thank you to Governor Perry. I don't know if he'll be there next go-round, and I don't know that we can take it from already the huge cuts that were there at the community side. But I want to talk very personally, because sometimes you think that things are going all right. And our children, particularly those that have been in the foster care system, are really at risk. And those that even have been adopted into loving families are really at risk. And all I can say is I am so grateful for places like Clarity in San Antonio. that takes children, even if it's a 90-day commitment. And I'm hoping that that'll be enough for my niece. It may not be. But I'm going to share with you because it is shared by my sister and her husband, who have adopted 6 children. The oldest, she's actually 14 today, and she's at Clarity. We knew that she was a victim of abuse, and like many, she protected her younger brothers and sisters. She was finally removed when she had a broken jaw and nose. But what we never knew about, nor did she ever outcry about, was the sexual abuse, until she began having those hormones and sexual feelings on her own. And it is devastating to our family, and it is devastating to her to finally have that. So a child that you think is just so happy and on her way, all of a sudden it is rebellious and wanting to hurt herself. And that was the only place that she needed 24-hour one-on-one care. She, like many of our young people, is a cutter, trying to heal and try to inflict that pain to forget. And it's going to take a long time. But I want you to think about her today. Her name is Yvonne, and there are many Yvonnes in this state. There are many of them who, even with all circumstances pointing in their favor, have gotten such a horrid break in their early years that it's going to take years. My friend, who is a human trafficking survivor, who was sold at the age of 10 and 11. She was prostituted out and drugged up. And it was because of a mental health outreach person who was trying to help her with her heroin addiction that really got to the core of she was a very young human trafficking victim. But we know that it's not just those types of stories. It is what I call the true clinical diagnosis. Those young people with depression. And on June the 16th this year, we mourned as the 3rd anniversary of the death of my nephew, who didn't know, like many of our profiles, we didn't know that he had a severe depression or any sort of bipolar disorder until that first manifestation, and things seemed to be going really well. But one night, it just didn't. He was 23, and our family is still in a vacuum for the brightness and the love and everything that Wesley brought to our family. And so I want to thank you for commenting and saying that I've been a champion, but you see, I'm just fighting for my nieces and nephews, and I'm fighting for my kids. I'm fighting for your kids, and I'm fighting for my cousin who was at the San Antonio State Hospital for 18 years. I'm fighting for the people that I know. Every family has a family member. And if I could scream at my colleagues and say, but don't let this happen, we can do something to prevent this. We can have a better system. And I would. I've tried logic, I've tried numbers. This next legislative session is going to be equally brutal. And so we need your organized voice. We have had some champions. I got to tell you, the folks that are going to talk to you, I think Garnett is here. He is absolutely one of my heroes. It's Garnett Coleman and the House. And the new champions that I call them, Senator Rodriguez is on fire about this mental health issue. Those of you from the El Paso area, find your champions and then find that collective voice. Strategize, get your focus, and organize, organize, organize. There's also a little election in November. For those of you in different communities where there is an election, ask your legislative candidates how they stand on these issues. If this is the issue that is really important to you, because if not, they're going to be elected by folks who think that, you need to have school vouchers, or you need to get rid of the Department of Environmental Quality. Find the issue and then organize and vote. I know that collectively your voices do make a big, big difference. And just know that wherever you are, I'm going to be right along with you, fighting every day and every minute of that legislative session. Thanks, and I look forward to hearing some of the questions. I know Garnett's going to come here, and then we're going to have a lot of the questions. Thank you. The most precious gift that you can give is your time, and that those of you that have been here today, you're giving your time. Gracias.